Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. This podcast is on two articles recently published in the Lancet on the efficacy and safety of Nerinetide. Nerinetide is a neuroprotective eicosapeptide designed to reduce ischemic brain injury by disrupting the interaction between N-methyl-D-aspartate receptors, the NMDA receptors, and downstream excitotoxic signaling. It was tested in two major clinical trials for acute ischemic stroke. In the ESCAPE-NEXT trial, which was a multi-center double-blind randomized controlled trial, 850 patients with acute ischemic stroke due to large vessel occlusion undergoing endovascular thrombectomy without prior thrombolysis. IV Nerinetide 2.6 mg per kilo was compared with placebo. The primary outcome was functional independence, modified Rankin score of 0 to 2 at 90 days. Key findings: no significant benefit. Safety: no excess adverse events in the Nerinetide group. The next study was the Frontier trial, which looked at IV Nerinetide in acute cerebral ischemia. It was a phase 2 multi-center double-blind randomized controlled trial. 532 patients with suspected stroke treated by paramedics within 3 hours of symptom onset. IV Nerinetide 2.6 mg per kilo was placebo, administered before hospital arrival. The primary outcome was functional independence in 90 days, modified Rankin score of 0 to 2. Overall, neutral results, no benefit in all suspected stroke cases. Potential benefit in ischemic stroke with reperfusion therapies. Patients who received thrombolysis or EVT had better functional outcomes with Nerinetide. Confidence interval 1.03 to 3.28. Safety: no excess adverse events observed. Implications: further studies needed to confirm its role as adjunct therapy in patients receiving early reperfusion therapy. Current evidence on Nerinetide: safe with no significant adverse events, no overall clinical benefit in broad stroke populations, possible benefit in specific groups such as ischemic stroke patients receiving thrombolysis or EVT. Key future research directions: optimal timing of administration. Could Nerinetide be more effective when given closer to stroke onset? Second, patient selection, identifying specific subpopulations, example, non-thrombolysis endovascular therapy patients or thrombolysis recipients. Combination therapy, testing synergistic effects with reperfusion therapies, example, thrombolysis plus Nerinetide or hyperbaric oxygen with Nerinetide. Alternative dosing strategies, investigating repeated doses or higher concentrations for better neuroprotection.